Hello, my name is Evie and today I will be talking about my understanding of psychological perspectives. We will be identifying the key assumptions of these perspectives, covering the work of key theorists, analysing the similarities and differences between perspectives, and how each perspective is used to understand contemporary issues in psychology. Psychological perspectives are approaches on how we try and understand why people feel, think and act in certain ways. There are 5 main perspectives which are discussed by researchers: the psychodynamic, the behavioural, the cognitive, the biological and the humanistic perspective. I will be focusing on the biological and behavioural perspectives today. Let's start with the behavioural perspective. Behaviourism is the theory that behaviour is learned through experiences with your environment, focusing on how the environment, punishment and rewards influence behaviour. It believes people learn through classic conditioning and operant conditioning. Classic conditioning is learning through association, which means you learn to connect one thing to another. For example, imagine a pupil hearing the school bell every day right before dinner time. In the beginning, the bell is nothing but a sound. However, over time, the pupil may start to feel hungry after hearing the bell. This is because their brain has learned to associate the bell sound with having their dinner. Operant conditioning is learning through rewards and consequences. For example, if a pupil does well at their homework and is rewarded for this, then they are more likely to try and do well again. At the same time, if a child touches a hot oven and is burned, they immediately learn that they shouldn't do this again. There are many advantages to the behavioural perspective. The behavioural approach is seen as reliable and scientific as it centres around behaviour that can be observed, meaning it can be measured and repeated. Research and theories of behaviourism have led to them being applied in the real world. For example, behavioural therapies and positive reinforcements within schools. These perspectives help us to understand how certain habits and fears are made. Even though the behavioural perspective has its strengths, it also has its limitations, such as not contemplating how emotions or thoughts can affect behaviour as well. This perspective centres around that behaviour is learned through experiences and the environment, but it ignores how biology and genetics could affect this too. Finally, most of the experiments within this perspective are done on animals, which cannot give a true representation of how humans would behave in these circumstances. Theorists such as Ivan Pavlov and John B. Watson are known for their work on behaviourism. Ivan Pavlov was a Russian psychologist who is best known for his discovery of classic conditioning through his experiment with dogs. His experiment showed that their behaviour could be learned through association. He found out while studying the digestive system of dogs. He noticed that the dogs were salivating when they saw or smelt the food, which is a hardwired response. He started by ringing a bell just before the food was brought out to the dogs. As the repetition of this, the dogs then started to salivate at the sound of the bell ringing alone. This experiment showed that animals and humans can learn through association. This process is now known as classical conditioning. This experiment showed that behaviour isn't always instinctive, but it can be learned through repetition. Ivan Pavlov's research had many strengths that helps us to understand how people and animals learn. He used controlled experiments which were able to be repeated, which made them more reliable, giving the approach more credibility. Ivan Pavlov inspired other researchers like Watson and Rayner. Pavlov's work has been used to help people with anxiety, addiction and phobias, and his experiment gave clear proof that behaviour can be learned by association. Ivan Pavlov's research also had its limitations. Pavlov's experiments were done on animals, so the findings may not explain how humans learn. Human behaviour is the cause of more complex emotions and thoughts. Ivan Pavlov only focused on behaviour that can be observed and not on thoughts and feelings, which makes his research less useful for explaining human behaviours which are more complex. There were some ethical concerns with Pavlov's experiment. Some people felt that using animals for experiments is unethical, as they may be distressed or forced into unnatural situations, as guidelines for animal research were less strict than today. John B. Watson was an American psychologist who is best known for his Little Albert experiment. He believed that all human behaviour is learned through experiences and the environment. Watson and his assistant Rayner carried out an experiment on an 18-month-old baby called Albert. When Albert was first shown a white rat, he showed no signs of fear. However, after Watson paired the rat with a loud noise and repeatedly, Albert started to show signs of fear when only seeing the rat without any loud noise. This experiment showed that Albert had learned to fear the rat through classical conditioning. John B. Watson's research had its many strengths, such as he used controlled experiments that showed classical conditioning in humans. As this theory showed behaviour is learned, this helped people think more about child development, which caused new approaches in parenting and education. This experiment showed that emotions like fear could be conditioned, which showed that behaviour can be shaped by the environment. Watson's work also had its limitations. Watson's research was seen as unethical as his experiment involved scaring a baby intentionally. An experiment like this would not be allowed today. Things like thoughts and emotions were ignored. This was a short-term study as well. They did not follow up on Albert, so we did not know if the fear lasted or the result had any lasting effects. Finally, this experiment was only done on one child, meaning this could not represent how other children or people would have been affected and how they would have reacted. The biological perspective focuses on how our biological makeup affects our behaviour. This perspective believes that behaviour should be explained because of the biological structures and processes, as humans are seen as biological beings. The biological perspective has its strengths and weaknesses. Let us look at the strengths first. This approach can use scientific methods, which makes this approach more reliable as it uses things like MRI and brain scans. This perspective has driven benefits in the real world, like for medication for mental illness, which has improved people's lives. This perspective can explain how biology does affect behaviour due to studying things like genetics, hormones, and brain injuries. The limitations of this perspective include that it only focuses on genetics and biology, meaning it does not contemplate the effects of the theory nature versus nurture. People also argue that this approach is too simplistic as it centres around only the effects of the biological processes and does not consider emotions or even social interactions. Even though medication is helpful for some people, it cannot work for everyone. This approach focuses on medication treatment but does not look at the long-term effects of this or even the root cause to the problem. Theorists such as Paul Broca and Carl Wernick are known for their work on the biological perspective. Paul Broca was a French physician, anatomist and anthropologist, and he was most known for his research on the brain and the discovery of the region of the brain which is now responsible for speech productions, which means it helps us to pronounce words. This area is known as Broca's area. Broca discovered this area of the brain while treating a patient who was unable to speak any words, only the word tan, which they became known as. Tan was still able to understand spoken language. After Tan had passed away, Broca carried out a post-mortem examination on his brain and he found there was damage to his frontal lobe. Broca established that this area was responsible for speech production. Broca continued to study patients who had related symptoms and problems and discovered a pattern. Broca's research and theory had many strengths, such as Broca's research was the first evidence that proved areas of the brain were responsible for different things. As this was revolutionary, it changed the way people looked at the brain and allowed people to look at the specific regions more closely. Broca had many different patients who had the same symptoms and speech issues, meaning his credibility kept growing. His work was based on clinical observations on living humans, but he was also able to gain evidence from brain post-mortem examinations after they had passed. Broca's work did have its limitations. At the time, there was no modern technology such as brain scans, so he only had the evidence from the brain post-mortems after the patient had died. Therefore, he could not know what was happening in the brain while it was alive. Broca's most famous case study, Tan, had speech problems for over 20 years, so it is not known if over the time other areas of the brain were affected as well. and he believed that speech and language production was only controlled by one region. However, more recent research shows that language production is involved in multiple parts of the brain, not just the frontal lobe. Karl Wernicke was a German neurologist whose work followed on from the work of Paul Broca. Karl Wernicke is most known for discovering Wernicke's area in the brain. This area is now known to be responsible for language comprehension. It helps us to figure out both spoken and written language. He studied people who were able to speak fluently, but they were unable to understand language and their sentences made no sense. Wernicke studied many patients, and this created a pattern. As when he studied their brains after their passing, he discovered they all had damage to the left posterior temporal lobe, contributing to the fact that biology is the cause of behaviour of people. Wernicke's theory came with many strengths, such as he used clinical observations and post-mortem brain examinations to contribute to his evidence. Even though technology was limited at the time, more modern technology has been able to confirm this research. This research has caused healthcare to improve for brain injury patients and neurosurgeries. Limitations of the research is Wernicke did not have access to modern technology, so it was unable to study the brain while the patient was living. He believed that language comprehension was controlled by a single part of the brain, but modern technology has proven it is not only this single area. Let's look at the similarities and differences of the perspectives themselves. Even though the biological and behavioural perspectives are very different, they do have similarities. They are both scientific methods to study behaviour. They both use controlled clinical settings. Both perspectives are focused that behaviour is determined by factors we cannot control. For example, the biological perspective thinks behaviour is caused by genetics, biological structures and hormones, whereas the behavioural perspective thinks behaviour is caused by our experience, environments and reinforcements. Finally, both perspectives have had a positive effect on modern treatments today, such as antidepressants and therapy. The main difference between these two perspectives is that they believe the cause of behaviour is determined by different things. The biological perspective focuses on genetics, hormones and biological processes of the body, where the behavioural perspective focuses on the biology and evolution. Where on the other hand, the behavioural perspective focuses on behaviour being shaped by the environment. These perspectives have introduced different types of treatment, like the biological approach focuses on medication and the behavioural approach focuses on therapy. In summary, the biological approach looks inside the body to explain actions, and the behavioural approach looks how behaviour is shaped by the environment and experiences. Let's look at how these approaches affect us today. The behavioural perspective continues to affect us, especially in areas involving mental health, education, parenting, and even the criminal system. As this approach has proven that reinforcement techniques such as rewards and praise help to support positive behaviour, schools today use this approach with children, just the same way parents do. Similar techniques are used in prisons to hopefully decrease the number of reoffenders. Techniques are also used to support people who have anxiety, phobias and addictions, such as exposure therapy. This approach has also brought the media to our attention, as now people realise people may learn behaviour through watching TV, playing online games and social media. Even when buying anything online, companies will help you have a positive experience buying from them, making you more likely to be a returning customer. Classical conditioning is relevant today in treating mental health conditions like phobias, anxiety and PTSD through techniques like systematic desensitization. This technique helps people with fears. For example, if a person fears dogs, they will gradually be exposed to related situations in a calm environment, essentially conditioning the person to feel differently about certain situations. While this perspective is based on scientific evidence and good for using in schools and therapy, positive reinforcement in schools and While this perspective is based on scientific evidence and is good for using in schools and therapy, positive reinforcement in schools and for parents may work. However, then However, then they ignore that this might not work for all children, ignoring their thoughts and emotions. Although, if this strategy is also overused, it may become less effective over time. This approach oversimplifies human behaviours which are complex and may involve more than just behaviour which is learned. Just like the behavioural approach, the biological approach has revolutionised the way we look at how behaviour is caused and how we can help. This approach focuses on the biological processes in the body, which now has led to drug development for patients with depression and anxiety. This perspective has used twin and genetic studies, and it has been proven that mental health illnesses or conditions may run in families. Studies like this may lead to early diagnosis, meaning treatment is more likely to be effective. Brain scans and MRI scans has given us an insight into how the brain functions and how they relate to behaviour and mental processes. However, there is a risk of becoming over-reliant on medication, which may lead to side effects or dependence. By using medication to help, it may never address the underlying emotional causes or the root of the problem. Medication can reduce symptoms, but may not also be a long-term solution. Thank you for listening.